Signs and symptoms most to look for is facial droop, speech impairment, arm or leg weakness, and time is the most essence for this. And sometimes you can also find them, they'll compare with visual deficits, or they will fall, or they're having balance and coordination issues. Some of these are mostly associated with stroke. Different locations of the brain present different kind of symptoms. And the faster you get to a stroke center, the better it is for treatment. Facial droop, arm weakness, speech impairment, and time. However, sometimes I go beyond that and tell them not only arm weakness, but it could be a leg weakness, or it could be unable to ambulate, ataxia, visual changes. These are all part of stroke depending upon the location where the stroke is occurring. Yes, best thing is to call 911. And the most common mistake that people do is that because they look at the commercial on TV, that let's give an aspirin right away. And they go and give aspirin to the family members. However, we have to realize that there can be hemorrhagic stroke, there can be ischemic stroke. So if they're having a hemorrhagic stroke and we give them aspirin, it can be a worse outcome, or we are doing more damage. So it's better to call 911 and have them sent to a stroke center. It is very important to go to a primary care certification facility with the stroke center. However, sometimes the faster you go to a place where they can treat you or they can triage you and then transfer, that is okay as well. Sometimes not all smaller counties will have that kind of facility. Rather than delaying any kind of care, it's better to go to a facility where they can triage any harmful like blood pressure or blood sugar or any other abnormalities. The most common risk factors for is common things such as blood pressure poorly controlled, high blood pressure, low blood pressure sometimes, diabetes, high cholesterol, smoking, cardiac history, like if you have coronary artery disease, congestive heart failure, all those factors, renal failure, those are all associated with stroke. The most other important thing is non-compliance. When people don't manage their blood pressure, their blood sugar, or did not take medications regularly, that can also have a major impact or can put them at a risk for having a stroke. Now, blood pressure high can also put them at a risk for having a hemorrhagic stroke, which is nothing but bleeding in the brain. And so monitoring your blood pressure, your blood sugar, following with a primary care physician regularly are very important to prevent a stroke.